Ibuprofen can raise your blood pressure. Yes, it can. Also, other medications in the class of NSAIDs, non-steroidal anti-inflammatory drugs. Ibuprofen is in that class. There are others. Yes, they can actually potentially raise your blood pressure. A lot of my patients do not know that. If you are taking ibuprofen routinely or taking a lot of it, etc., your doctor does not know. First of all, they should know this anyway. Second of all, it's also important because it could be affecting your body in ways you didn't imagine. Guys, we are talking about 9 medications that can raise your blood pressure. Number 2 is another common one my patients are taking are decongestants, whether it's part of your allergy medicines, your asthma medicines, cough and cold medications, what have you. Many people, many of us go to the drugstore looking for medications to take. We are stuffed up, we are whatever. And if they have a decongestant in them, it actually could be raising your blood pressure. That's right. And actually, it can do this to the point where there are many patients I have that I suggest that they take medications that do not have the decongestant in them. You should know that decongestants could raise the blood pressure, okay? Another one is steroids. That's oral steroids, different types of steroids, whether it's prednisone, etc. Whether you're on steroids for a short period of time for an acute illness or if you take steroids long term, understand that steroids can increase your blood pressure. This is something I often have to take into account with my patients who may be on steroids for different things when I am checking their blood pressure in the office. I should say that when it comes to things like steroids and the NSAIDs that I mentioned, like ibuprofen, they increase blood pressure by increasing salt and water retention. All of these medication categories increase blood pressure through different mechanisms. The decongestants do it by vasoconstriction, or rather they sort of constrict blood vessels, and that's how blood pressure can be raised. Fourth category, this is a surprise to a lot of people, are antidepressants. Not all, but some of them. Some popular ones, some common ones that people are on, like Effexor and Wellbutrin, can actually raise your blood pressure. This video is not a message for you to say, oh my gosh, I'm on a medicine that could be raising my blood pressure, let me stop the medicine. No, 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 no. If you're on these medications as prescribed by your doctor, you need to have a conversation with your doctor about the potential risks and benefits of everything that they have put you on. If you are taking something on your own, such as the NSAIDs like ibuprofen, or if you're getting over-the-counter medications and your doctor does not know about that, this video is to prompt you to bring that up to them for that reason, to have this discussion. Have a discussion with your doctor regardless, okay? Antidepressants can raise your blood pressure. Keep that in mind. And as I said, this is not a message to stop your medications, okay? And remember, these medications will not raise blood pressure in everyone, but they can raise blood pressure, and they often do for some people. All right, the next category is ADHD medications. ADHD medications are often in the stimulant category. They can increase heart rate, they can raise blood pressure. This is really important if you're on a stimulant for ADHD. The next thing is estrogen-containing medications, whether it's birth control or something else. Estrogens can raise your blood pressure. In fact, when we think about blood pressure, when we think about putting a woman on birth control, one of the things that I'm looking at is blood pressure, among other things as well. Just 3 more categories. The next is nicotine. If you're on nicotine replacement or what have you, nicotine can raise your blood pressure, so you just want to know that. Also, another category is some weight loss medications. One that comes to my mind in particular is phentermine. Phentermine can, in particular, that medication can raise blood pressure for some. The last category are immunosuppressants, such as cyclosporine or tacrolimus. These are medications that are often used in organ transplant patients, also used in other patients, not just organ transplant patients. Some immunosuppressants can raise blood pressure. That is something that the prescribing doctor really should know about, and you guys should have a conversation about risk versus benefits, etc. Again, not a word, or rather not a message to stop your medications. This is a message to know how other medications that may very well be very important for your health and livelihood in life could impact other things, right? There are always potential risks and benefits to everything that we take. So this is a message to you to talk to your doctor about how your meds could affect your blood pressure, and then also to be very thoughtful about if you are going to the pharmacy picking up certain things that you need to talk to your doctor about this, because it could affect your blood pressure as well. Let me know if these are medications you're familiar with in terms of raising blood pressure, if there are other medications you're aware of. And by the way, this is not an exhaustive list. There are other medications that raise blood pressure. If you're aware of those, those, put those in the comments. Sometimes what you write helps other people, so I encourage you to comment. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos and all sorts of stuff. Please like and follow my page if you have not. For those of you on Facebook, thank you in advance for sending stars. I respond personally. Also, consider joining my subscription groups at Dr. Jen Superstars. And on YouTube, please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen. Oh, guys, also check out my my website, Dr. Jen Caudle, for lots of other stuff. So let me know what you guys think. Guys, I'm Dr. Jen. I'll see you soon.